Okay, in transitioning, faith-based institutions are well positioned in their mission to address social determinants of health and well-being by giving power and voice to those that have been marginalized, who are often invisible or ignored by society. The Greater Cleveland Congregation, a consortium of faith institutions, crosses the lines of class, religion, and color to work on social justice issues in Northeast Ohio. GCC has flexed their considerable muscle, most notably at the state level in Ohio, as a major driver in a campaign that led to Governor Kasich's decision to expand Medicaid, which brought health care coverage to 750,000 uninsured Ohioans. Quite a feat. Today we're going to hear how they pulled it off. GCC has also taken on a range of other challenging issues in the greater Cleveland community to improve the lives of those most in need. Our next speaker, Donna Weinberger, was a co-chair of that monumental Medicaid campaign. Donna serves on the board of the Greater Cleveland Congregation and is also a member of Kol Halev, a Jewish community focused on education and service. Befittingly, Kol Halev means from the heart. And so as a native Clevelander and a fellow Cavs fan, go Cavs, I'm happy to give the floor to Donna Weinberger to share her story. Donna.
Is this on? Yeah. Good afternoon, everyone. And thank you, Terry, for that very nice introduction. We both were able to watch the end of the Cavs game last night, which was a special treat, and Kamani warned us that they were on TV. I am here to talk about the role that one particular faith group played in influencing policy, healthcare policy in the great state of Ohio. Greater Cleveland Congregations, or GCC, is a county-wide, multi-faith community organizing group of 43 congregations. As Terry said, we unite people across race, class, and religion to fight for issues for the common good. We are Christian, we are Muslim, we are Jewish, we are Black, we are white, we are Latino. In our short 6-year history, we have had major victories in Cuyahoga County, in criminal justice reform, in gun violence reduction through our national Do Not Stand Idly By initiative, in education, and in employment. But our first and one of our most important victories was to help bring Medicaid expansion to the state of Ohio in 2013, which provided desperately needed health care to over 700,000 previously uninsured Ohioans. So here we go. How GCC helped get Medicaid expansion. I'm going to be a little more than 5 minutes this time, but as I always subtitle it in our houses of worship, we say from Psalm 6, how long, O Lord, how long? Because it was a really long roller coaster journey and a real lesson in politics for our burgeoning organization. We had all bought into the community organizing principle that it takes organized people and organized money to affect change. But this was one of our first campaigns, and it was a true test of our resilience, our relationships, and our strength. As the old organizing maxim reminds us, organizing campaigns are a marathon, not a sprint. So, come with me, here we go. Come with me on a journey way back to 2012 where this all started. Lesson number 1 in community organizing, always be looking for opportunities. And in this slide, you see a big one. Because of the work of our great criminal justice team, we were able to influence Governor Kasich and the Ohio legislature to pass and sign a major collateral sanctions bill. Kasich signed the bill at one of our own member congregations, Elizabeth Baptist Church, in July of 2012. Let's go back to July of 2012. What was going on then? As a reminder, it was just before this, in late June 2012, that the U.S. Supreme Court had upheld the Affordable Care Act, right? So at that time, they also ruled that acceptance of Medicaid expansion was optional for the states. In a discussion with the governor after this signing, he began to talk about this with us. We found the governor somewhat open at the time, and he talked with us for a very long time. Note here, and this is important, the governor is a religious man. In his subsequent speeches, when he talked about Medicaid, he talked about the morality of the expansion. He talked about, quote, bringing people out of the shadows, and even made references to St. Peter and the pearly gates. He loves to talk to clergy. At the same time, we got hints that he was open to expansion. He also, though, was expressing concern about the impact on the state budget, and he referred us to the Medicaid director for the state and director of healthcare transformation for the state to have more conversations. So, after hearing about the governor's openness, GCC went into research mode to decide if we were going to take this on. And here's what we learned. There were, at that time, they were estimating 600,000 uninsured Ohioans at the bottom of the income spectrum who would get health insurance if Ohio moved forward with expansion. This included 80,000 people in Cuyahoga County. Many of these people were represented in our congregations. They included unmarried childless adults making less than $15,000 a year and parents making between $20,000 and $30,000. Expansion would affect especially one of Cuyahoga County's large populations that was very represented in our churches, which was the ex-offender population. We also learned the expansion would cost very little in the first 3 years and would slowly increase in costs, but it was estimated that expansion would bring in $1.43 billion over 8 years. To us, this was a no-brainer, right? And also, this is very important, we began to hear in our conversations with the State Office of Healthcare Transformation that the administration was seeing expanding coverage not just as covering people, but as a key component of driving reform. They were interested in a front-end investment in dollars that would lead to a focus on primary health care, mental health care, and prevention. These were all things our clergy and our faith communities wanted. Third thing, GCC's research also made us start believing that a campaign to do this was winnable. We don't take on campaigns that have no chance of winning. We don't joust at windmills, okay? So, we began to see if we could put together a coalition and add more organized people to us. A team began reaching out and doing meetings, and our expanding diverse coalition became known as NEOMEC, the Northeast Ohio Medicaid Expansion Coalition. I would say, and this is really important, that this was probably the most important role that GCC played in the expansion. A group based on faith leaders was probably the only game in town who could get all the stakeholders to sit down together at the same table. This was very true for competing, viciously rivalrous hospital systems who didn't talk to each other, who may or may not have the initials CC and UH. I'm just saying. It was also true for the progressive community and unions actually sitting down with the business community. We got everyone to sit down together. I am also proud to say that this NEOMEC coalition became the model for 5 other similar coalitions throughout the state of Ohio. So, Throughout the fall and winter of 2012, we began to strategize and push around this. In January 2013, we began to hear that the governor was more and more open to expansion. So what did GCC do then? We publicly gathered to show our support, our strength, and show the governor that we would have his back if he did this. GCC organized an assembly of about 1,300 people in one of our big Baptist churches to demonstrate support. The event included testimonials from uninsured Ohioans, providers, small business owners, and senior leadership from all 4 major hospital systems. Throughout the winter, GCC and NEOMEC also participated in almost weekly lobby days in Columbus. There, our congregants learned how to hone messages to legislators, how to work in a team, and how to deal with all kinds of reactions from aides and legislators. We call this citizen action in training. Citizen training in action, sorry. We teach people to participate in the democracy that is supposed to represent them. And our efforts paid off. As you see here, on February 5th, Governor Kasich announced he was going to include expansion in his 2-year budget. So we thought we were as good as gold, right? No, not exactly. The Republican-led legislature was not going to do this easily, especially with threats that they would be primaried by the right in the next election. Outside money started pouring into the state for this purpose. In this slide, you see members of our very own GCC team strategizing with the governor in Columbus. It would take many more meetings like this to get this done. Again, Governor Kasich loved talking to us religious folks. Then in April 2013, we got word that the Ohio House had stripped Medicaid from the budget. So what did we do then? On 3 days' notice, we filled 5 buses with members of our congregations, joined other coalitions throughout the state at a rain-soaked rally on the State House steps. In this way, we put the legislature on notice that they could strip things from the budget, but we were not going away. And we didn't go away. We had more lobby days, more press work throughout the spring. We kept the pressure on. As they say in community organizing, the key here is persistence, persistence, persistence. We also canvassed in 3 strategically targeted neighborhoods in Northeast Ohio. These were all swing districts where we urged voters to contact their state legislators. And our persistence did pay off. Not through the legislature exactly. They managed to put in an anti-Medicaid line item in the budget, but the governor struck it out before signing it. So after little activity during the legislator's summer break, in the fall we put our heads down and went back to work, doing press opportunities, op-eds, and then working with the governor in early September in a coordinated state effort. And this was a pretty bold move. We pulled petitions and began taking the first steps toward putting Medicaid expansion on the ballot for a vote. In this way, we pushed the legislature to either come to a vote themselves or face the prospect of getting the issue before the voters. They did not want this to happen because it would bring out people to vote that they didn't want voting. Our congregants, trained by our union partners, who are really good at this, were instrumental in getting petitions signed to get the issues on the ballot. The petitions ended up getting pulled after about 6 weeks when it became clear that Governor Kasich had made a deal and had something else up his sleeve, which led to finally this. On October 21st, 2013, Kasich did an end run around the legislature and brought the matter of Medicaid up to something called the Ohio Controlling Board. If you asked 100 Ohioans before this happened, what is the Ohio Controlling Board? 99% of them would have said, I don't have the vaguest idea. The board, up until that time, had been used almost exclusively for obscure budget issues. But in a deal to get rid of the petitions, the Ohio House Speaker agreed to replace 2 of the members of the board with sympathetic members right before the vote. The board ended up voting 5-2 to accept $2.55 billion in federal money to cover the costs of expanding Medicaid through July 2015. The bet became that once that was in place, it would be really hard to remove an entitlement later. The day that the controlling board passed this through is also known as, in my family, as the day that Mom learned to use Twitter. As I was hanging on the State House news to see if this was really going to happen. And when we got the news, we felt finally like victory was ours. Well, not quite. Because there were immediate lawsuits filed with the Ohio Supreme Court, giving us another 2 months of waiting and waiting. One of our mottos on the GCC healthcare team was, we are not stopping until this is signed, sealed, and delivered, cue Stevie Wonder. But finally that day came on December 21st. The Ohio Supreme Court did deliver and cleared the way for expansion of Medicaid to uninsured Ohioans. So, 4.5 years later now, right? Where are we and what have we learned? This is a conference on population health, so I think it's important to give you the basic report on the analysis that came out recently about what Medicaid has done. I am not a statistics or a person, so if you want all that, you should go to medicaid.ohio.gov and read it all, but here's the basics. Expansion in Ohio has provided health insurance for far more uninsured than we originally thought, providing coverage for about 750,000 people. It also has reduced the homeless population, reduced food insecurity, and has dramatically increased access to mental health care. For a state like Ohio that's been devastated by the opioid crisis, it has provided real treatment opportunities for those who previously could not access care. It has also provided additional resources to cities and towns throughout Ohio. Healthcare is the second largest industry in the state of Ohio after agriculture. And the Cleveland Clinic is the second biggest employer after Walmart. Expansion has been crucial to the economy. Of course, since passage, there have also been numerous threats, mainly focused on eligibility restriction, bills that would require drug testing, cost sharing, work requirements. The faith community has risen up when needed. Up until recently, we've been successful in doing that by either nipping things in the bud in the legislature or getting the governor to veto them. But the governor is termed out in November. The new federal administration, we know, is very gung-ho in what they're calling community engagement hurdles, and we don't know what's going to happen next. So lessons learned here are very few. 1, community organizing is all about relationships. Public relationships, such as the coalition we formed, are vital to effecting change. A community organizing principle is there are no permanent friends and no permanent enemies. Ordinarily, we might be on the opposing side of the Cleveland Clinic, say, when it comes to their lack of investment in the surrounding community. We might also be on the opposite side of Governor Kasich when it comes to, say, his record around guns. Though that is true, they were both our partners in this, and we couldn't have done this without them. This is hard for some people of faith to swallow, And as we have to say over and over again, we can't be purists in this work. Number 2, power is not a dirty word. It takes a willingness to understand power and how to wield it when necessary in order to win. Politics can be dirty and nasty. This is also sometimes hard for clergy and people of faith. Also, our organization had to be reminded often that we are working right now with the world as it is, not the world as we wish it would be. The world as it is, in the world as it should be, politicians should do the right thing and should do the moral thing. In the world as it is, they are immersed in the world of dirty money and primaries and all of that stuff. So it behooves people to actually look at what is in the self-interest of politicians and go from there. I would add, though, that sometimes the self-interest can be surprising. It's not all about money and re-election. For instance, Governor Kasich told us at one point that his brother had a severe mental illness. And when he talked about getting people out of the shadows, he was thinking about his brother. Okay. So we got a lot of leverage from this campaign. We have been able to use our relationship skills and our coalition building skills to work on things like mental health crisis centers, to keep people with severe mental illness out of jail. But in closing, as it's often said, every good community organizing speech has to include a testimony and a story. And as I tell you this story, here's what I want you to focus on. There were 3 of us who led this campaign in Ohio, and often we would get immersed in the, zero-sum wins and losses, and all of that is necessary in the strategy. But sometimes you also lose sight of why you're doing this work. So here's the story. After our big win with the Supreme Court, my 2 healthcare co-chairs and I went out to celebrate. And we were ready to celebrate. And we went to a restaurant and we ordered drinks. And we must have been really, really quick to order drinks because our young, very sweet waitress sort of looked at us and said, "Oh, are you celebrating something?" And we said, "Yeah, but probably not what you think." And we explained that we had been working on Medicaid expansion for a long time and victory was ours. And during that explaining, I looked at her and expected that I would get the usual reaction that I get when I talk about Medicaid expansion, which is usually people get glazed over eyes and look the other way. Or sometimes I would get a comment that was something like, "Oh yeah, my mother's on Medicare." But instead, from this young woman, we got this. "Oh my God, really? I've been waiting for this day. I'm 26 and I haven't had health insurance since I was 18. Can I buy your drinks?" And I thought I saw tears in her eyes. And I will name her. Her name is Lauren. I got to know Lauren after that, and she told me her whole story. She had severe asthma, but almost could never afford her inhaler. Instead, she and her mother shared an inhaler when her mother's asthma wasn't too bad, until the day came when her father was laid off and forced to take early retirement, and then, of course, there was no insurance at all. Lauren had worked since she was 15. She had recently finished beauty school and was slowly building up her clientele, but having to work many hours on these different jobs. For health care, she tried to cobble that together through a community health center and the dental school, but that required many hours of lost work time, which she didn't have, so she just basically skipped health care altogether. We finally did let Lauren buy not our drinks, but our coffee that night, because I realized that she needed to do this to feel bonded with us in this victory. The victory, as we must always remind ourselves, was for the Laurens in our midst. It was for my mental health patients. It was for all the fellow congregants in GCC and all the working poor and the disabled and the veterans and the parents who will now be covered. Victory was theirs and ours and all of ours. And as we say in GCC, can I have an amen on that? Amen. Thank you.
Thank you, Donna. That was a great story. And as you would say, that's the quintessential example of praying with your feet, as she says in action. So I think we have time for questions. I believe, Kamani, can circulate the mic, please.
Hi, I'm Michelle Reese with the North Carolina Institute of Medicine. Thank you for your story. I'm curious, since Medicaid expansion passed in Ohio, what your organization and other faith-based organizations what kind of involvement you've had in getting the word out about Medicaid expansion and eligibility and trying to recruit folks who might be eligible.
Right. So after the expansion was passed and navigators started appearing and enrollment started to happen full force, we made sure that that was happening in our congregations, and that was a really important piece. Since then, we're mostly working on other issues, but whenever there's a threat, we rise up and do what we can to take care of it. I had an interesting conversation the other day with someone who's very immersed in this world policy-wise in a way that I'm not, and he was saying that there's a good chance that there's going to be something passed where there's a work requirement. But what he was raising was that there probably would be an opportunity to do volunteer work instead of just work, and that we could play a role as congregations coordinating and providing that volunteer work. So.
Thank you so much for that inspiring story and full of lots of lessons learned. But I have to believe that all that you've learned, can you tell us more about what you're setting your eyes on next and how you're using some of these relationships and this connection with health and faith to take on your next challenge?
Right. So one of the things that's near and dear to my heart as a therapist, this is through our criminal justice team, where we are working hard to get so many people out of jail and prison. One of the most important ways to do that is to work on getting the mentally ill out of prison. And so what we are working on currently is really pushing to get two mental health crisis centers built, one on the east side and one on the west side of Cleveland, where there can be drop-off from police and law enforcement. We have been able to bring together a coalition so far of judges, the Mental Health and Addiction Board, the County Prosecutor's Office, and there is no doubt that, first of all, the respect that we got through this process has led them to want to help us in other things that they might not have necessarily done. And our coalition building skills have really helped us in that process.
I wanted to ask a question, Donna. What do you think are important considerations in sustaining the broad-based coalition that you have, and how are you approaching that? What are some key levers that people should think about
when you have a coalition like that,
and how to sustain it over time?
To me, the main one that I came away with is don't react. So we had times where one hospital system would get up and say, I'm not working with you anymore. And it was easy to be reactive and to feel like the whole thing was going to fall apart. But I think to remind yourself over and over that there was self-interest involved for all these people at the table. and it made no sense for them to walk away. So to sort of be the non-reactive, faith-based, we're opening everything with a prayer stance helps everyone sort of settle down and focus more on the wider good rather than their tiny little ego or self-interest at the moment.
Any final questions?
Angelo Birch, Interdenominational Ministerial Alliance. How was it getting the African American churches involved? And then I have a follow-up to that, but first.
So our coalition does have a number of African American churches. It's a very interesting political question because there are a number of churches that don't want to ally themselves with us, and actually the pastors that have tend to be young, on the younger side, and see this kind of coalition as very powerful because it is interfaith. But there's a little bit of a split in Cleveland around it.
Okay, and I guess that was going to be my follow-up to that, is have you looked as to why that is? I think a lot of times, and I hope no one takes offense, but it is what it is. I think that when it comes to African American pastors, and not only African American pastors, but Latino pastors, is that when we see Caucasians coming into our community, it's always like they're coming in to help us out. And as I tell so many, stop helping, you're killing me.
Yep.
You come, folk, and so we could do so much better work when we're at the table, not when we're called in after things have been done. And I find that when it comes to conferences like these, I look around and I see so many, and then everyone's saying, well, we're the African American pastors, we're the Latino pastors. We're never called. We're called when you need some color at the table, but we're not called when you're trying to build the table. And I think in order to change this, we're going to have to be brought in when you have these discussions. Bring us in to hear how it's going to be best for our community, because we have people on Medicaid, we have people on Medicare, and we want to help them out, but we're tired of folk pulling us in because now we need you to speak.
I think that's an excellent point. I think it stands on its own. I will say that our leadership is also African American. So, we have tri-chairs and 2 of them are African American. And so it's not just, I agree with you, it would never work to just pull people in.
Thank you very much.